for a little while. You ready? You ready to go? Come on, let's go.
My name is Mary Lou Alexander. I live in Dunwoody, Georgia, a suburb of Atlanta. I've experienced achalasia for 12 years. I cannot swallow food. And what I did swallow came back up. It was very embarrassing.
Achalasia is a disease of the esophagus, which is the conduit that delivers the food that we eat from the mouth to the stomach. It's a tubular organ that has a muscle coating that squeezes and propels the food into the stomach. And it also has a valve, a sphincter, between the esophagus and the stomach that relaxes to allow the food to transition to the stomach and then contracts again to prevent reflux of food and acid. Achalasia compromises this function to the point where the esophagus doesn't properly propel the food into the stomach and the sphincter does not relax to let the food into the stomach.
Achalasia tends to be a progressive disease. So initially, it felt more like acid reflux, and I think she was treated for that. Then, over time, her gastroenterologist would treat her with Botox injections, which tended to loosen the opening into the stomach.
So I had Botox injections for probably 9 years, which caused a lot of scar tissue.
Finally, the Botox injections stopped working, and my mother's life changed drastically.
I couldn't go out to eat or anything like that. My daughter was always running me smoothies. She had her children trained too to bring me smoothies. I was really slowly becoming an invalid.
I got onto the internet and I began to learn what I could learn about achalasia. I took my mother to the top guns in this country. We went to Cleveland. We went to Chicago, we went to California.
When I traveled to other experts, what they wanted to do was totally open me up, cut my chest open.
Most of them thought that because my mother had had extensive Botox and potentially a lot of scarring, they predicted that my mother would, in the end, have an esophagectomy. So they would try and do a laparoscopic procedure and it would likely fail. And some of them would try and comfort her by telling her, but don't worry, being on a feeding tube isn't that bad. I connected with other achalasia patients in this country, and they were able to share with me the idea of what was considered a new procedure at the time, which is called POEM.
POEM is a Heller myotomy, which is and has been the gold standard for the treatment of achalasia for the last 20 years. Essentially, it's a surgical incision of the muscle that forms a valve, a sphincter, between the esophagus and the stomach. For the last 20 years, this has been done surgically with 5 incisions onto the abdominal wall. Now we can do the same exact cut through the mouth, simply with an endoscope such as that used for normal upper endoscopies, and deliver the same result with much less invasiveness.
It seems logical to a layman. Why do you need to make incisions when the esophagus is fully and readily available to you through the throat? So as just a human, I could say, why do you have to cut my mother's abdomen when you can access the sphincter of her stomach from her throat?
Compared to Heller myotomy, POEM has been shown to be faster, result in less blood loss, and result in faster return to daily activities and work compared to Heller. And all this while maintaining the same high efficacy and low complication rate.
After all this research and travel, I quickly concluded that Dr. Stavropoulos at Winthrop-University Hospital offered the least invasive procedure available to an achalasia patient. And he had done close to 100 procedures at that time. And he was quickly able to tell me that of those 100 procedures, he'd had no failures. I felt that I was putting my mother in excellent hands. And as I saw my mother weaken, Dr. Stavropoulos seemed really to be a beacon of hope for us. While other people were quick to tell us, I can't guarantee you anything, Dr. Stavropoulos was positive. He was confident of his ability because the equipment is something that he's familiar with, and the procedure is one that he's done many times on people whose achalasia is even in more advanced than my mother's.
And the day she called and told me that he said that he would see me, we both sobbed because we were so excited.
Mary Lou came to us from Atlanta, which is actually not an unusual situation. We have had now patients from over 20 states in the United States. To make this logistically feasible, we evaluate the patient remotely, so then they only have to come for one trip for their procedure.
We made a decision to fly to New York. We saw Dr. Stavropoulos in his office briefly before the surgery. The procedure took a little bit longer than he anticipated it would take. But Dr. Stavropoulos believed that if he could complete the myotomy, my mother's quality of life was going to be drastically improved, and it has been.
After the POEM, the vast majority of patients go home the next afternoon.
The results were immediate. Anybody who has achalasia will know that you're starving. My mother was starving.
POEM is one of the most gratifying procedures that I do because of the immediate relief it provides and because of the dramatic change in the quality of life of these patients.
3 days after surgery, my daughter rented a car and she drove me through New York City, and we had a great day.
Our Winthrop-University Hospital stay was pleasant enough that we worked in a small family vacation.
I remember fondly seeing her in the office before she returned to Atlanta because she felt well enough to go and collect some strawberries from the Hamptons that she brought to her office visit.
But while my mother was still staying in the hospital, she was able to taste and drink a cup of coffee. And I remember what a pleasure that was for her. Her life was back. We were able to eat in restaurants. My mom would talk about how great it tasted and felt to be able to eat a big salad and chomp on a raw carrot.
My life now is very pleasant. I go to lunch with my friends, with my family. I drive my husband where he needs to go because he had a stroke, which we haven't been able to solve that, but I do take care of him. And anyone else that needs me in the family, I'm always there to help them too. I'm extremely active and I go to the gym every day, go on the treadmill. I just lead a fulfilling life.
Winthrop-University Hospital was a delightful place. We felt very welcome there. We felt that we were getting top-notch care, and we felt like we were getting the best surgeon in the country.
It's a great advantage to be able to have the procedure in a hospital that has obviously the volume and the experience, but also tradition is very important. We were the second hospital in the world to perform POEM because of a tradition of innovation and pushing the envelope in endoscopic procedures. It's great to work in an academic center with an emphasis on teaching and research because these are the centers that foster this kind of innovations that have dramatic results in the health of patients. It's not really a diverticulum. We have a live course every year that brings the foremost experts in POEM in the world to perform live endoscopy cases at Winthrop, which are webcast around the world on the internet.
You don't need to do what I did. There is no reason to travel to Cleveland. There's no reason to travel to Chicago or to California. I've been there for you. You need to choose the least invasive procedure with the most experienced surgeon. That's the POEM method, and that's Dr. Stavropoulos.
He really just extended my life.